So Emily's been kind enough to let us video her treatment here today for a couple of reasons. One, it helps my channel out, but two, she's going to be leaving us eventually when she graduates, and she wants her future chiropractor to see how we treat here because she really likes what we do here at Drummond Chiropractic. So we're going to have you start with you on your back, face up. So she has a lot of jaw issues, so she really likes the jaw work, where we work on the outside of the jaw and also on the inside of the jaw. So for inside the jaw, we put gloves on, and she knows this does not feel the best. But right now I'm working on the masseter muscle. Oh, and it's actually, that side's even tight. Yeah, she's feeling that. Keep breathing. And all I'm doing is a press and release technique because these muscles are really small and I don't want to irritate them. It's a fine line with these small muscles of helping them versus irritating them. Oh, it's starting to release. Yeah, does that feel better?
Mm-hmm.
Yeah. Now we're going to go behind the teeth, and she knows to swallow while she has this opportunity, and then go and open and relax. Now I'm going on to the pterygoid muscle. It's a muscle deep behind the back molars there. There it is. Keep breathing. We'll do a couple more presses. One more. All right, good. And I don't do that too much because we don't want to irritate that muscle at all. And then we'll do the other side, because even if they're just sore on one side, we always do both sides because it's the same bone. So if this is tight, it can irritate that jaw and vice versa. All right, yeah. You can tell not just from the tension of the muscle, but from her reaction. You can feel that one right there. Yeah, it's tight both sides today.
Mm-hmm.
'Tis the season.
Mm-hmm.
I'm going to stop there. I'm going to do that again because that's quite tight still.
Yes, that's the one that was bothering me today.
Yeah, I can tell. So we got to do it a few more times than normal, but still being careful not to over treat it. One more. Let it go. There it goes. And now that was still tender, right?
Mm-hmm.
But you can tell it was softer.
Mm-hmm.
Perfect. And then we're going to do the inside muscle, relaxing. Oh, that one's not bad. Just a little bit on the top. Good.
Mm-hmm.
That wasn't too terrible, but it was tighter than normal.
Yeah.
Busy at school, I'm sure.
Mm-hmm.
All right. So then we're going to check her cranium. She tends to have tight suboccipital muscles. All that hard work. Yeah, that right there is the anchor to the muscles that go down to the shoulder. And you can see your shoulders want to roll forward. So keeping those shoulders back and down, which is easier said than done.
Mm-hmm.
And all I'm doing is a nice gentle traction to mobilize the cervical spine so the adjustment's more comfortable and easier to do. She tends to have a little bit of tension in her cranium, so I do a little cranial release. And I have a video that describes how you can do your own cranial release. And it's important to have a cranium that is a little bit flexible. There are suture lines in the cranium that are called immovable joints because there's no muscle designed to move them, but they do wiggle a little bit to accommodate the changes in barometric pressure to keep that pressure off of the brain. And then there's some headache points that I like to torture her with. And that's a little tight.
Mm-hmm.
Just letting go though. There it goes. Tender but less tender, right?
Mm-hmm.
So we'll move on. Ooh, that's ouchy. Keep breathing. Try to relax the face. Yeah, just so you know, this is quite tender on her. She's doing really well at not showing her pain. I know, it's almost done. Oh, it's starting to go.
Mm-hmm.
There it goes. All right, then we're going to do the sinus points. Not too bad. I'm still going to use the Alba's oil. Let's make sure you like it. I'm going to give her a little extra treat today. There's been a lot of sickness going around, and I love this oil for preventing sickness. It's got all kinds of herbs in it that help fight. You like that smell? Can you smell it?
Yeah, it's fine.
And that's okay to use on you?
Mhm.
Because if you don't like the smell, it's going to linger on you for a minute.
Okay.
All right. It kind of smells like Vicks Vapor Rub, but it actually has herbs that are helpful instead of just a petroleum product with menthol. And it's got a nice cooling effect that's good for the nose and the sinuses. All right, you ready for the noise? All right, got one there and one there. All right, here we go. Go ahead and breathe in. Exhale, relax your shoulders. Think about your toes. Nice. And then we'll do the other side. I'll let you let that settle in before we do the other side. That was pretty big.
I think I needed that.
Ready for the other side? Okay. And then breathing, exhaling. Well, that was even bigger. You were tighter on that left side today. That's unusual.
Yeah.
Get some massage cream here. There we go. That's not as tight as usual. So that's good. Have you been doing your stretches?
Yeah. I feel like it's mostly around my left side right now.
Okay. Do you know why it switched to your left?
Holiday?
Yeah.
That's like you said.
That's right. Different activities lead to different stressors. All right. That's going to feel good. I'm going to do the front part because the pecs can get really tight when the shoulders roll forward. Those muscles get super tight. So it's good to stretch those too. It's always important to look at the front, the back, the left, and the right, and above and below because things can travel. Right there. That's a cross pattern. Yeah, she feels that one. There it goes. I know it's still tender, but can you tell it's getting less sharp? Yeah. Couple more to get rid of that tenderness. Because what makes it tender is that muscle contraction is making metabolic waste, and that muscle, when it's stuck in contraction, it limits the blood flow and the lymphatic drainage, so it just builds up in its own metabolic waste, which makes it very tender to touch. But as the muscle softens, the blood can flow, the lymph can drain, and so all that waste can just drain away. See how much better that feels? Awesome. All right, we're going to do your hands. Yeah, I feel that too. Our hands are used and abused, and that's an anchor point for those muscles that control the fingers. Give that little break. Let that breathe, drain. Let's try that again. All right, a couple more. I'm going to let that go for a second. I'm not done with that. I think that just needs some time to flow.
Sorry.
No, it hurts. I get it. It's like relax as I press on your tenders. All right, we're going to do that again. Try to relax. I'm going to do a kind of a more intense one for just a second. Two more. Try to relax. I know. Ooh, that's a good one. One more, okay. And then I'll probably go back to it because it's not quite done. Yeah. Okay. And we'll let that flow a little bit more. I'll get back to it. And relaxing the elbow. Well, your right arm is better than your left arm, and you're so left-handed today. And then we'll do the shoulder. And then raise your arm up. going to go in the armpit because there's muscles in there. We always check the muscles in the armpit because that can affect shoulders and neck. I'm going to go back to that left elbow because it was problematic today. Let's try that again. But see how it's more tolerable now?
It's not as bad as it
Yeah.
was.
Because sometimes once you get the flow started, you don't have to keep meat tenderizing it. You just get it started and then check it, make sure it completed on its own. And I think it did. What do you think? Yeah.
A lot better.
Yeah. And that's where the art comes in, making sure you don't over-treat, especially when they're a little more sensitive. And we're going to do the feet. That was neat. I wasn't even trying. Pulling the toes a little bit. How the feet been doing?
Good.
Good. But I still like to keep them loose so they stay healthy. Got a little bit of a twist to you today too. Yep. Make sure your ankles are good and the forefoot. Good. And we'll check the knees. A little free one there. And then there's, just like there's muscles in the armpit, there's muscles in the groin area that anchor from your femur to your low back, which could affect your back or your hip. So we'll check those muscles. Just a little ticklish, but that's not sore, right?
Yeah.
So far, so good. Fine, right? Perfect. All right, now for the fun part, some more noise. So lay on this side, facing me this way, and then relax your head. Get my hair out of my face. Are you ready? All right, breathe in, exhaling. Nice, that was perfect. Let's do the other side. And this is kind of just your standard side posture. She does really well with this move. And breathe in, exhaling, dropping the knee. Perfect, that was good, wasn't it? And then on your back.
I always look forward to that.
One of her favorites.
Oh, my back is
Yeah. Another thing she really likes is what we'd like to call the hug move or the bear hug move. Because she has a lot of kyphotic curvature to her mid back. Just because you're a student, you do a lot of studying. So we're going to give yourself a hug. You're in a good spot in the table. Maybe come down just a little bit. There we go. And then lift up a little bit. Breathe in and fall down. Oh, let's reposition a little bit more. Breathe in. Exhaling. Breathe out. Relax your head. Relax. Come on. There it is. Man. And as little as she is, she does take a bit of a wallop. Let's get you on your belly face down. All right. And I'm going to get a pillow and then raise your feet up for a second and lower back down. And I typically like to put a pillow underneath their ankles just so we don't hyperextend their knees when we put a lot of pressure on those muscles. So we'll check her calf muscles. And then we're going to check the posterior thigh muscles and the buttock muscle, low back. This is where she needs some work. Is that okay to put pressure there?
Yes.
Okay. And her traps are tight. That's where that right side was hiding a little bit. That's her typical spot. Carrying the weight of the world on her shoulders. All right, we'll do the other side. Right there. So I'm just doing a little bit of mobilization for her ribs. That was a nice little one. Did you feel that one? Not sure if you guys heard that one at home, but there's a tiny little click there when that rib moved a little better. All right. And for kicks and giggles, I'm going to turn the flexion table on just to stretch that lower back out a little bit more. We're going to buzz that back. I really like this rapid release therapy because like the name suggests, it works really quickly. Just a few passes of this and it melts muscles like butter faster than I would have done in 15 minutes of myofascial release. That feels good, right?
Yeah.
Little bit right there, wasn't there?
Mm-hmm.
Just like that, no time at all. All right. Is there anything else you need today?
No, I think that's it.
All right. And I always ask that at the end of the treatment because you want to make sure you got everything. She's got a bit of a laundry list going on. Go ahead and set it up and see how you feel.
Good.
Good?
Yeah.
All right.
Thank you.
You're very welcome. So again, thank you for watching. If you have any questions, we'd love to hear from you. Post them below. And until next time, stay well.